Hello everybody, welcome to your online clinic. Today we're going to be talking about anemia, okay? Anemia is a very common condition, especially in people of African descent, okay? What is anemia? Anemia is a condition in which you lack enough healthy red blood cells to carry adequate oxygen to different body tissues, okay, or different parts of your body. One of the signs of having anemia is that you feel tired and weak. There are different types of anemia, okay? It can be a temporary condition or it can be long-term condition. Anemia can also be mild and can also be severe, okay? Anemia may also just be a warning, like a sign to serious illness, okay? Treatments for anemia range from taking supplements to medical procedures. You might be able to prevent some types of anemia by being on a healthy diet, okay? You will hear people talk about different types of anemia to include aplastic anemia, iron deficiency anemia, sickle cell anemia, thalassemia, and vitamin deficiency anemia. Okay, let's explore all those in simple terms. The signs and symptoms you will experience from anemia vary depending on the cause of the anemia. Remember, anemia is simply a lack of supply of enough oxygen or the inability of your red blood cells to carry enough oxygen to different organs in your body. Some signs and symptoms include fatigue, weakness, pale or yellowish skin, irregular heartbeats, shortness of breath, dizziness or lightheadedness, chest pain, cold hands and feet, and headaches, okay? At first, anemia can be mild, so you may not notice it, but symptoms of anemia tend to worsen, okay? So you would want to ask, when do you know to go see a doctor? When should you see a doctor? Most people go, see the doctor. Most people are moved to see a doctor because they are extremely fatigued. Okay? There are many causes of fatigue. So when you go to complain of fatigue, the doctor is going to put you through different tests. Okay, one of the tests will be to measure or to have like a blood test done to see how much red blood cells you actually have in your system, okay, and compare it to what is considered the norm. Bleeding can also cause your body to lose red blood cells, okay? And in some cases, your body, in some illnesses, your body will destroy the red blood cells it makes, so you end up not having enough, all right? What do red blood cells do? 3 types of blood cells. The white blood cells, which fight infection, the platelets, which help your blood clot in case you have an injury so you don't bleed out, and the red blood cells, which carry oxygen through your body. Red blood cells contain hemoglobin, and hemoglobin is an iron-rich protein that gives the blood its red color. Okay, hemoglobin enables the red blood cells to carry oxygen from your lungs to all parts of your body, and also to carry carbon dioxide from different parts of your body to the lungs to be exhaled out. Okay, most blood cells, including red blood cells, are produced regularly in the bone marrow. Okay, you all know bone marrow, okay? It's a spongy material that is found in the middle of bones, especially large bones, okay? To be able to produce hemoglobin and red blood cells, your body needs iron, okay? Vitamin B12, folate, and other nutrients that can be found in the food you eat. Let's talk about the different types of anemia and their different causes, okay? Iron deficiency anemia, like we said, if one of the things that your body needs to make blood is iron, okay? Now, the most common type of anemia is caused by a shortage of iron in your body, okay? Your bone marrow needs iron to make hemoglobin. Without adequate iron, your body cannot produce enough hemoglobin or red blood cells. Without iron supplementation, okay, this type of anemia occurs in many pregnant women. It is also caused by blood loss, such as from from heavy menstrual bleeding, and ulcer, cancer, and regular use of some over-the-counter pain relievers, especially aspirin, which can cause inflammation of the stomach lining, resulting in blood loss. Okay? Now, a friend of mine some time back called me and said he was feeling very tired, lightheaded, dizzy. The first thing I asked him was the color of his poop, because if your poop is black, you know, the colors of your poop tells us what is going on in your stomach, right? You know, I'll come to that discussion in another episode. Let's just stay with anemia. What I'm trying to say is that from the color of your poop, you can tell if there's some kind of blood loss. So if you told me, or if he told me that he's been having black colored poop, I would recommend like a fecal occult blood test to see if there was any blood in his stool, and from there follow up with more tests to see where in his intestines he is bleeding from. Okay, so vitamin deficiency anemia. Besides iron, your body needs folate and vitamin B12 to produce enough healthy red blood cells. A diet lacking in these and other key nutrients can cause decreased red blood cell production. Okay, some people who consume enough B12 are not able to absorb the vitamin. All right, this can lead to vitamin deficiency anemia, also known as pernicious anemia. Okay, so the health of your stomach, the health of your stomach lining is crucial in absorption of necessary vitamins, necessary minerals that are needed to build healthy red blood cells in your system. Okay, all right. There's also anemia caused by inflammation. Certain diseases such as cancer, HIV, rheumatoid arthritis, kidney disease, Crohn's disease, okay, and other acute or chronic inflammatory diseases can interfere with the production of red blood cells. Aplastic anemia. Causes of aplastic anemia include infections, certain medicines, autoimmune diseases, and exposure to toxic chemicals. Autoimmune diseases, like you know, is when your body is a condition where your body attacks itself. Okay, all right. So anemia is associated with bone marrow diseases. A variety of diseases such as leukemia, myelofibrosis can cause anemia by affecting blood production in your bone marrow. The effects of these types of cancer and cancer-like disorders vary from mild to life-threatening. Okay, there is also hemolytic anemia. Hemolytic means breakdown. This group of anemias develop when red blood cells are destroyed faster than the bone marrow can replace them. Okay, certain blood diseases increase red blood cell destruction. You can inherit hemolytic anemia, or you can develop it later in life. And there is also sickle cell anemia, which plagues a lot of people from Africa. Sickle cell anemia is a condition where the red blood cells in your body take a different shape. They're shaped like sickle. This is caused by a defective form of hemoglobin that forces red blood cells to assume that sickle shape, okay, crescent or sickle shape. These irregular blood cells die prematurely, resulting in a chronic shortage of red blood cells. Okay, a lot of people in Africa are carriers of the sickle cell trait, where most of their red blood cells have that sickle shape, and as such get destroyed quicker than the normal round shape of red blood cells. Okay, and when this happens, there's a shortage of red blood cells in the system. Why do they have this? This is actually an adaptation against malaria, because it has been found by researchers that red blood cells that are sickled do not really permit the growth of the malaria parasite in them. Okay, so the life cycle of the parasite is disrupted because it's unable to reproduce in that red blood cell that has that sickle shape. Okay, but at the same time, this adaptation against malaria causes a lot of Africans to be subjected to the condition of anemia. Okay, now risk factors that increase risk of anemia. Okay, a diet lacking in certain vitamins and minerals, like we said, diets that are lacking in iron and folate will and B12 will increase your risk of anemia. Intestinal disorders, okay, that affect the health of your stomach or your stomach lining will also affect the absorption of nutrients in your small intestine. Intestinal disorders like Crohn's or like celiac disease will put you at risk of anemia. Another group of people with intestinal disorders will be those people who had like stomach reduction surgery, okay, bariatric surgeries that reduce the amount of stomach lining they have. This reduces the surface area that would absorb vitamin B12 and other necessary nutrients. So these people would have to be on a lifetime of supplementation of those necessary vitamins. Okay, so menstruation amongst women puts them at a risk of anemia. Okay, iron deficiency anemia. In general, women who haven't had menopause have a greater risk of iron deficiency anemia than do men and postmenopausal women. Of course, postmenopausal women are not menstruating anymore, so they get to keep their iron. Menstruation causes the loss of red blood cells. Okay. Pregnancy is another condition that if you're pregnant and you're not taking a multivitamin with folic acid and iron, you are at increased risk of anemia, and this is not good for the health of your baby. Okay, chronic conditions like cancer, kidney failure, diabetes would put you at greater risk of developing anemia. Okay, anemia of chronic disease. These conditions can lead to a shortage of red blood cells. Slow chronic blood loss from an ulcer. Okay, so if you have an ulcer and blood is continuously being lost from that ulcer, this can deplete your body of its storage of red blood cells. You will not have enough body store of iron, and this will lead to iron deficiency anemia. Okay, a family history. If your family has a history of inherited anemia such as sickle cell anemia, you might also be at an increased risk of anemia. Other factors, let's say autoimmune, like we discussed, alcoholism, exposure to toxic chemicals, and the use of some medications that affect red blood cell production will definitely lead to or predispose you to developing anemia. People over 65 are also at an increased risk of anemia. Let's see the complications that can be caused by the condition of anemia. All right, like we tried to discuss in the symptoms, severe anemia can make you so tired that you cannot complete every activities of daily living. Okay, pregnancy complications. Pregnant women with folate deficiency anemia may be more likely to have complications such as premature birth. Okay, so we encourage all pregnant women to stay on top of their vitamin supplementation. Okay, heart problems. How does anemia induce, or how could it cause heart problems? Okay, anemia can lead to a rapid or irregular heartbeat, usually called an arrhythmia, because when you're anemic, your heart must pump more blood or make up for the lack of oxygen in the blood, and it works harder. When it's forced to work harder in the long run, it could lead to you developing an enlarged heart or heart failure. Okay, anemia, believe it or not, can lead to death. Okay, some inherited anemias such as sickle cell anemia can lead to life-threatening complications. Okay, losing a lot of blood quickly can result in acute or severe conditions of anemia that can be fatal. In people that have sickle cell anemia, oftentimes they have what is known as crisis. A crisis happens when this irregularly shaped blood cells block vessels that supply blood to key organs in the body. And when they block these vessels and cause a lack of blood supply, the organ starts to shut down because of a lack of oxygen feeding the organ. All right, so when they develop crisis, it has to be managed, quickly. Otherwise, it could degenerate into fatality. Another condition we observe in people who suffer the condition of sickle cells is priapism, where the penis is, where blood supply to the penis is choked off. So a person with priapism suffers an erection of, prolonged erection. And when this is too long, it could lead to tissue death. And this is why we encourage people who have sickle cells and are experiencing priapism to immediately consider it as an emergent condition and go to the ER to have that sorted out. Okay, now how do we prevent anemia? Many types of anemia cannot be prevented, but you can avoid iron deficiency anemia and vitamin deficiency anemia by eating foods that include a variety of vitamins and minerals. Okay, where do you get iron-rich foods? Let's talk about that. Iron-rich foods include beef and other meats, beans, lentils, iron-fortified cereals, dark green leafy vegetables, and dried fruits. Okay, so immediately your mind goes to the vegans. What will the vegans do for iron? Okay, like we mentioned, there are the dark green leafy vegetables, the spinach, the kale, in Africa they have the ugu leaves. These are very healthy vegetables that will boost up your iron supplementation. Okay, folate. This nutrient and its synthetic form, folic acid, can be found in fruits and nuts, juices, dark green vegetables, again, green peas, kidney beans, peanuts, and enriched grain products such as bread, cereal, pasta, and rice. Okay. Vitamin B12. Vitamin B12, foods rich in these vitamins include meat, poultry, dairy products, fortified cereal, and soy products. Okay. Vitamin C. Foods rich in vitamin C include citrus fruits and juices, peppers, broccoli, tomatoes, melons, strawberries, and these also help increase absorptions of necessary minerals and vitamins in your stomach. Okay. If you are concerned about having developed anemia, or you want to know where you stand in terms of whether you have anemia or not, next time you visit your doctor for a physical, request for a blood panel to be done. Okay, your blood panel will show how many red blood cells you have, the shape of your red blood cells, the color of your red blood cells, and the symptoms you describe with your doctor or describe to your doctor will help him determine if you have anemia or not. Okay, so there are many ways to care for patients who have anemia, as your doctor will help you understand. Okay, after diagnosis, doctors treat anemia by ensuring that the cause of the anemia or the cause of the condition is reversed. They will also examine to see that you do not have any ulcers, or that you do not have any unhealthy conditions in your stomach or stomach linings, your intestines, and all that. Okay, they will also check to see that you do not have any chronic conditions like autoimmune disease, cancer, or familial disease, genetic diseases like sickle cell or thalassemia. And after that, They will do what is necessary to reverse the condition, and then you are good to go. You can click on the consult button, the consultancy button, to reach us, and we could take you through a specialized care for your condition if you have been found to have anemia. Our doctors and nurses, in-house doctors and nurses, are on hand to answer any more questions you may have on this condition. Okay? All right, we look forward to hearing from you. We look forward to serving you. We look forward to doing whatever it takes to keep you happy and healthy. Once again, my name is Regina Askia Williams, your New York-based family nurse practitioner, reaching out to you from our online clinic. All right, it's good to have you.